Vice President Yemi Osinbajo has inaugurated the 2021 Multiple Indicator Cluster Survey (MICS) and National Immunization Coverage Survey reports to track socioeconomic activities of the country's population. Osinbajo, represented by the Minister of Finance, Budget and National Planning, Dr. Zainab Ahmed, said the survey was a comprehensive household survey. The Vice President said that the present administration had continued to make efforts to ensure the gap reported in the last MICS survey in 2016 were addressed.
Concerted efforts have been made by the current administration of President Muhammadu Buhari to address the data gaps reported in the 2016-2017 report, which has led to massive investments in the healthcare sector, with particular emphasis on primary healthcare delivery and immunization coverage. The education sector also is not left behind. The government will continue to provide necessary support to all sectors, particularly the maternal healthcare, so as to mitigate the incidences of maternal mortality and safe delivery of our women and better life for both the living and unborn children that are the future of our great country, Nigeria. I want to assure you that the government of Nigeria will continue to strengthen all sectors of the economy to ensure a balanced development both at the national as well as at the subnational level of governments. Government will continue to ensure the provision of primary health care to all Nigerians to enable our country achieve her development goals and meet up with the 2030 agenda.
Prince Semiyu Adeniro, Statistician General of the Federation, said the 2021 MICS/NICS reports provide evidence-based data for all key stakeholders to prioritize quality services for children and women with higher efficiency and effectiveness.
This round of the survey, which has over 200 indicators, recorded the highest response rate in the history of mixed series in Nigeria. They recorded impressive response of 99% rate. Also had some notable improvements that were added, making it the most comprehensive mixed survey ever to be conducted in Nigeria. These improvements were in the form of an addition of entirely new questionnaire to the survey, as well as the inclusion of new modules to the existing questionnaire that we have. A completely new questionnaire, which focuses on children aged 5 to 17, was introduced under this sixth round of the mix. This questionnaire deals with issues such as foundational learning, child functioning, and parental involvement. New modules were also added to existing questionnaires. New modules such as energy use, social transfer, and food security, which we all added to the household questionnaire. While new modules on victimization and financial inclusion were added to the questionnaire for women and men.
Peter Hawkins, UNICEF representative in Nigeria, said the MICS and NICS data would help Nigeria better access the progress of its global and regional commitments, which seek to promote the welfare of women and children.
And the report is very interesting to read. Child mortality has decreased from 1 in 8 in 2016, dying before their 5th birthday, to 1 in 10 today. Very importantly, though, I want to bring out one area, immunization rates. They have gone up, Penta 3, from 34% in 2016 to 57% today. Only in the past 3 years, it went up from 50% to 57%. These are remarkable figures, as they show an increased access and delivery of immunization services despite the COVID-19 pandemic. Congratulations to all involved. There's also been significant progress in exclusive breastfeeding, birth registration rates. Exclusive breastfeeding has increased from 24% to 34%, while 50% of Nigerian children under the age of 5 now have their births registered with civil authorities. That is compared to 47% in 2016. In addition, child marriage, i.e. women under the age of 18, has dropped from 44% down to 30% since 2016.
The Executive Director, National Primary Healthcare Development, said the challenges of adequate human resources needed to be addressed at the primary healthcare level.
National level to address challenges such as only 27% of our primary healthcare centers countrywide have the right complement of human resources. We cannot jump to 80% or 90% until we address this. So I'm happy that the Nigeria Governors Forum is here. I'm here that the media is here. I'm happy that the Minister of Finance is here so that we can continue to engage with our governors, engage with our local government chairmen to address the issue of human resources, suboptimal human resources at the primary healthcare level.
NAN reports that the National Bureau of Statistics, NBS, implemented MICS in 1995 to provide data on child mortality, health, nutrition, education, child and social protection, women's health care and empowerment, water, sanitation and hygiene, while NICS was to access vaccination coverage provided through the health systems. Prince Clem Agba, Minister of State, Finance, Budget and National Planning, said the government would continue to provide the necessary support to the national statistical system to ensure the production of reliable data for tracking development projects.